Hello and welcome to this program. We have here today with us Dr. M. Ganeshan, consultant psychiatrist of the National Institute of Mental Health. Welcome to the program, Doctor.
Thank you.
To begin with, I'd like to ask you, what exactly is stress and what's the difference between stress and depression?
Stress is something that pushes us off the balance. Usually we are in an equilibrium where we are coping with our environment and coping with our inner environment, and anything that tries to push it away from the equilibrium into a abnormal situation, we can call it a stress.
Right.
So in our day-to-day life, we do face lots of stress.
So are you saying that there is a level of stress that people can cope with?
Sure. Yes. So, day-to-day we do face stress in all sorts of environments and all sorts of situations. And most of the time we do cope with them. But when the stress is overwhelming, when the stress is too much, then it can really push us off the balance. And then we can get into problems.
Right. So then what exactly is depression?
Yes. Now, depression is one of the consequences of facing stress, which is overwhelming.
Right.
So the facing stress depends on two things. One, of course, depends on the environmental factors, the things that around us that push us off stress.
Right.
And of course, our own capacity, resilience to cope with stress.
Right.
So the outcome is a balance of these two forces, the inner capacity to manage and the outer forces that are trying to push it off the equilibrium.
Right.
So when the equilibrium is disturbed, it can lead to many different consequences. And of course, one of them is depression. Other one is what we call anxiety disorders. And some people take on to addictive substances like alcohol, drugs to cope with their stress. So these are some of the different ways that we try and cope with stress. Of course, some are not very healthy.
Of course, yeah. So, can you tell me what some of the major symptoms of stress are? How do you know when you are stressed?
Yes. Sometimes the symptoms can be very subtle, so that we ourselves may not be aware of them.
Right.
But sometimes the people around us pick it up more than us. But some of the symptoms are like, one of the things is that our sleep gets disturbed. That's a common symptom, that we suddenly wake up at night or we find it difficult to fall asleep. That's a common problem. And a change in our eating habits. Sometimes either we tend to eat more under stress, or some of us tend to eat less under stress.
Right.
Another thing is that we can get more irritable with the people around us.
That means like getting angry easily.
Getting angry easily, jumping at people, being nasty to people whom we like and we work with.
Right.
And those are some of the symptoms. Another one is when it becomes more. Of course, we may want to go to the washroom more frequently. That's another symptom.
Right.
We may be sweating more. Sometimes we get palpitations. Our heart starts beating faster.
Right.
And also we can become more emotional. Like we tend to cry more, again become angry more, as we said earlier.
Right.
So these are some of the symptoms of stress which is going beyond the limits of manageability.
Right. So if a student comes into university to study, why would that be, how can that be a sort of a source of stress?
Yes. As we told earlier, environmental factors are very important.
Right.
So when we move from a known environment to an unknown or a new environment, where we need to face or we learn to face different types of stress, it's going to be a bit difficult in the beginning.
Yeah.
So unless we prepare ourselves and accept that, yes, I'm going to a new environment, it's going to be difficult. So one of the important things about coping with stress or managing stress is understanding that what are the situations that put me under stress, and then being prepared.
Right. So kind of a self-awareness.
Yes.
Right. So how does the body, you said that some of the symptoms are there, but how does the body react to like a very stressful situation? What kind of process goes on?
Yes. So when we face a new situation, and sometimes this new situation can be interpreted as a threat. So when our brain interprets something as a threat, it prepares our body for what we call the fight or flight response. So our adrenaline starts pumping, and so our heart rate goes up, our breathing becomes faster, and the blood supply to all the muscles and the body is increased. So we become flushed, and we have dry mouth, sometimes urge to go to the washroom, and so we get prepared for this, and that causes anxiety. So as I told you earlier, that palpitations come up because of that. But the problem is when the stress reaction is prolonged, goes on for some time, then it can be harmful. It can lead to depression and other health consequences.
How can university students in particular learn to manage this stress, other than being aware?
Yes, I mean, one, as we told, is being aware. And another important way of learning to cope is what we call reflection. And how being aware is being prepared before. But even after a stressful event, if I can go back and think, what was the stress I faced and how did I cope with it? Is this the way I really want to face stress? So kind of a reflection on what we have done helps us to put some things right sometimes. Because sometimes, for example, like if I find one lecture too stressful, it's being conducted in a language that I find difficult to understand.
Okay.
So my immediate response to that stress may be to cut classes and not go for them. And that might solve my problem in the immediate sense. But in the long term, it's going to be pretty harmful. So even if I cut one class, I need to go back and think, okay, I faced this stress, how did I cope with it? Was my way of coping with it a healthy response or not? That reflection will help me to a great extent to cope. So that is one way. Another way of coping with stress is to have a broad-based life. I mean, to exercise, we know, definitely helps. And also having hobbies, other interests, getting into other activities, socializing. So having a broad base helps you to kind of deflect the process of stress, because if you have one problem in one area, we can of course always go to a hobby. Like for example, if I like walking. So if I have a stressful day, maybe going for a walk makes me to relax and help me to cope with the stress. So having a broad-based life is very important.
And how about talking to friends?
Yes. Again, socializing is very important. And also, one important thing is to have the right type of friends. Choosing your friends, choosing whom you are going to socialize with is again another important skill that will be very useful to cope with stress.
So what kind of friends should you try to cultivate if you are undergoing a stressful situation?
Yes. I mean, some of our friends actually, unfortunately, can actually increase our stress level.
Definitely.
Right? So, say I'm supposed to be stressed before an exam, I feel I have not prepared enough. And, there are certain comments which can make me feel even worse. Right? And also some friends try to lead us towards unhealthy ways of coping. Like, I mean, we know alcohol is a very unhealthy way of coping, and we know, people do push others. Come on, we'll have a drink and then you'll feel relaxed. And so finding out the right ways of stress and finding friends who will help you to move in the right direction is very important. So friends who kind of support you, friends who kind of do not undermine your self-esteem, friends who encourage you to participate in good ways or the better ways of coping with stress are the right friends.
And those who empathize.
Empathize, try to understand what you're going through.
Now, after coping, using all these ways to cope, like reflection, understanding, hobbies, etc., at what point would it be necessary to seek medical help for stress?
I mean, when the stress is particularly overwhelming, and if it is pushing a person to kind of go towards the more unhealthy ways of coping, either becoming violent or getting addicted to substances or even contemplating some drastic action, like leaving the job or going away from the university or even contemplating suicidal ideas. That is when we need to talk to somebody. So we need to talk to somebody who will maintain confidentiality, because I mean this is something very personal and we don't want it publicized to everybody. I mean, unfortunately there is a fear that if you tell it to somebody, everybody will come to know and then there will be ridicule, so, which is fair enough, which is a sensible worry. So we need to choose the right people who will maintain confidentiality and access them for help.
Right. And now anyone who seeks help must also know that this is quite a common thing, right? They are not the only ones.
Yes, and also stress is part of our day-to-day life. We are going to come across situations which are going to be new, which are going to be stressful. That is inevitable in today's world.
Right.
And finding it difficult to cope is not a weakness. Is it not something that we need to be ashamed of? Yes, the more challenges we take on, the more stress we are going to face. Of course, if I don't take any challenges and be in my comfort zone, doing the everyday thing that I do, naturally, I'm not going to face stress. But that's not a healthy situation. So we need to go forward, we need to go out and take on challenges, and of course, stress will come. Yes. And it's not a mental disease. It's something that everybody goes through, as you said, and it can be coped with.
Dr. Ganeshan, do you have any sort of final words of advice to give us or our students about coping with the difficult environments, particularly maybe university or in general life itself?
Yes, I mean, as we discussed earlier, a change of environment is definitely going to cause stress. So students coming into university, which is a new culture, new environment from their comfort zones, is definitely going to cause stress to almost all of the students. So we need to understand that. And also we need to have compartments. So you have your university life, you have your outside life as well. And so if you learn good ways of coping with stress, then after some time, it becomes very manageable.
Thank you very much, Dr. Ganeshan, for coming today and giving your expert advice to us. Thank you very much.